Namaste. I am Dr. N. Manjunatha, Professor of Psychiatry, working at NIMANS, Bangalore. Today's in this video, I would talk about 8 key innovation needed in psychotherapy for Indian mind. When we hear the term psychotherapy, what are the thought comes in our mind? First thought comes is Western-based, manual-based, and book-based. Multiple sessions, length of the psychotherapy it may need to 6 to 10 years for dynamic and analytical therapy. It is the job of the counselors or job of the psychologist or social worker. And psychiatrist often says that I don't have time despite having the reasonable knowledge about psychotherapy. Patients and family perspective about the psychotherapy is a brainwash session or mesmerizing the patients. And in layman languages, it looks like talk therapy, chit chat therapy, or counseling. There are types of psychotherapy, lists are endless in the literatures. Coming to definition of psychotherapy, which Woolberg has given, is that it is the treatment by psychological means of the problem of emotional nature in which a trained person deliberately established a professional relationship with the patient with the object of removing, modifying, or retarding existing symptoms, or of mediating the disturbed pattern of behavior and of promoting positive personality growth and development. Please note that this definition doesn't have term like disease, illness, or something like that. Coming to acceptability of psychotherapy in India, it generally is very poor. Dropout is very high because one of the multiple sessions, it is very inconvenient to majority of the patients, and often it is said as expensive. Coming to effectiveness and cost effectiveness, all psychotherapy is equally effective. Despite there is slight preponderance of CBT in the literature, and there is a lack of studies on cost effectiveness in India. I guess it is low. Now I will talk about 8 innovation required for psychotherapy in Indian mind. First innovation, I have already made the slide video sometime back in my YouTube channel where I spoke about delete psycho from the psychotherapy, and we need to change the psychotherapy term to manotherapy. Coming to what is the psycho in psychotherapy? Psychotherapy has a two term, there's psycho plus therapy. Both terms are Greek terms. Psycho means psyche in Greek, which means spirit, soul, or breathe, are referring to the mind. Therapy means it's a treatment. Combining both will be a healing of the mind. Often the psycho is the term is met with an stigmatized terminology, negative connotation, derogatory meanings, and sometimes we will see that psychotherapy means for therapy for psychosis. In reality, majority of the neurotics need therapy. Why can't we call as a neurotherapy rather than psychotherapy there? Coming to manotherapy, please note that manotherapy is not the manotherapy. It is manotherapy. Delete prefix psycho from the psychotherapy. That's what I have been spoke in the last video. In our culture, we have a better term for psyche, that is manas means mind. It is we are using in India in every culture the manas. Hence, I propose the term manotherapy, mano plus therapy, which will be Indo-Greek term. The prefix mano in the manotherapy is derived from manas, which is a Sanskrit term. I will continue to use manotherapy in place of psychotherapy in this video. Second innovation required is a single session manotherapy. We need drastic reduction of the sessions. Often we would need this single session manotherapy, and we should promote walk-in psychotherapy shall be encouraged. No more intake and assessment session, everything finish in one session. My feeling is that short-term single session monotherapy is the commonest monotherapy required by 95% of our clinical population. And the inspiration come from this is the Jayadeva Institute of Cardiovascular Diseases at Bangalore, where single consultation which finishes everything. When it is been done for cardiac illnesses, why can't it be done for many of the human beings, distress kind of thing? That is the question. Third innovation required is a Tele-plus Manotherapy, which means that even though I talk about single session monotherapy, some patient may need second or third session, which should be based on tele rather than in person. Of course, first session it will always be encouraged is in person Manotherapy. Fourth innovation required is MANASVITA framework for single session Manotherapy. MANASVITA framework include M for mindful listening, A for acknowledgement, N for normalization, A for assurance and advice, S for support, V for validation, I for information or education, T for technique for the coping, A for action or planning. MANASVITA is the term is a Sanskrit term which means hope. That fifth innovation required in the duration of the monotherapy, which should be brief. I would suggest 20 minutes active session is good enough for majority of our patients who need monotherapy. Initial 5 minutes to find out the conflict or the stressor, another next 10 minutes to de-label the conflict using the MANASVITA framework, and last 5 minutes to reflect on what it has spoken last 15 minutes, and maybe include maybe homework or concluding the session. Maybe next 10 minutes maybe for write up if it is especially an academic and session. Sixth innovation required is the non-forcible advice in monotherapy. Currently, advice in psychotherapy is seen as a taboo. I would suggest advice is need of hour for our Indian patients. Very, very rarely our patient doesn't need advisors, otherwise majority of patient need advisors. What kind of advisors is preferred is a big research question. I think we need a lot of research on this thing, but my feeling is that advice should be solicited, it should be personalized, it should be non-forcible, and it should be calibrated advices. Seventh innovation required is in monotherapy for beyond the illnesses. Often the current psychotherapy focus on illness, which need to move beyond the illness. Maybe we take the help from the Trichotomy of Mental Health, which another video I have produced and put it in the YouTube. The Trichotomy of mental health is divided in wellness, distress, and illness. We need to move monotherapy beyond the illness toward distress and wellness. Actually, wellness-based monotherapy is in high demand, and distress-focused monotherapy is also badly needed in this world. Coming to eighth, innovation is required in focus in the monotherapy. What should be the focus in the monotherapy? This is here. It looks very. It is a complicated thing in the monotherapy. We need a lot of research in this to find out what is the issues in the psychotherapy to be elicited, like conflicts, and what kind of intervention is needed. That is a process. At the end, what is the target in monotherapy is to normalize symptom reduction and hope induction. Yeah, as I said, we need a lot of research in elicitation of conflict in the issues in the monotherapy and process in the session. For example, Hanuman therapy to increase the self-confidence, Gita therapy for resolving the conflict, advice for Guruchala based kind of therapy. There are few single session monotherapy which I have published some time back. I have been practicing in my practice and sometime in my teaching with the residents. Is that mind fits therapy for dissociative disorder. Here, the dialect which we use with the patient and family is very, very important. Sometimes we get confused what term I should tell to patient and family to convey what is the illness. So often that fits the terminology our people understand well. I would say that fits is related to brain fits. But mind fits is related to mind. Often the term you say mind fits, people get the message that it is for a stressful mind. So the moment they understand patient and family, that term, the mind is this fits is related to mind, which is a stressful mind. They find out the way and to reduce how to reduce the stress. So this is the beauty of single session therapy. Coming to next is relapse enrichment program. Initially, I wrote this article for alcohol dependence syndrome, but it will be helpful for our chronic diseases where relapses are very, very common. Despite the best treatment, despite the best effort from the patient, relapses very common in alcohol dependencies. Hence, why can't we just encourage patients and family to come repeatedly for relapse treatment, so that they reduce the active drinking days, to improve the abstinence period, so that people quickly come for 2-3 days admissions and go back in a sober mind. So next is these another single session monotherapy which I have been doing piloting in my practices is that reflective monotherapy, which is like SOS or crisis based single session monotherapy for personality disorder. I use the term personality defect or weakness in you. This whenever they come in crisis, I say that I will elicit reason for this and find out these are the defect which you have. You need to work it up. So every time when they come in crisis, I reflect back to this thing and saying that this you need these kind of interventions. So I feel sometimes it is helpful my practice. At the end, concluding single session monotherapy is need of the hour to meet the expectation need of our patients. Future of monotherapy or psychotherapy in India lies not in the wholesale import of Western model, but in evolution of a culturally intelligent, scientifically grounded, and systematically supported therapeutic ecosystem, rooted in Indian lived realities and responsive to global evidences. Thank you very much. Feedbacks are welcome in this video. I have already spoke about this thing in one of the conference in Jodhpur, with Indian Association of Private Practice 1 month back. Thank you very much.